heard the Minister of Health talk specifically around the plan to end federal mandates, but he didn't quite make it, Mr. Speaker. He talked about this complicated science and did not elaborate further. What we would like to know on this side of the House, Mr. Speaker, is what is this complicated science that the NDP Liberal government is not sharing, and when will the minister make it available to all Canadians?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Let me try again, thanks for the question, to make that very simple. One number this time instead of two. So 135,000. That's the number of Americans whose deaths were avoidable because of the fact that they had been vaccinated to the extent that we have been in Canada, in part due to vaccination mandates. They would not have died. Those lives, Mr. Speaker, have a value. How much it is in dollar, very few people will know, I suppose, but these have personal, health, human, social, and family values.
The Honourable Member for Cumberland-Colchester.
Mr. Speaker, I thank the minister for his non-answer reply to that question. We know there are countless employees federally that are off work who sadly perhaps have not been immunized. What about Douglas, who's a federal scientist, Mr. Speaker, and he has a unique story in that he's had COVID twice, and he's also in an antibody study from the Ottawa Health Research Institute. Interestingly enough, and shockingly, he works at home, and he's still not allowed to go to work. How can this happen? When will this federal government stop politicizing this and discriminating against hardworking Canadians, and the date they can go back to work?
The Honourable Minister of Health.
Thank you, Mr. Speaker. We spoke about responsibility, being responsible, being obviously kind to each other. I'll try to be even more simple. No, instead of 135,000, three, that's a simple number. 3 times is how many more deaths we would have had in Canada if we had followed the example of the United States when it comes to public health measures, vaccination rates. 3 times more people dying, Mr. Speaker. That's 60,000 more people in Canada who would have died.
The Honourable Member for Thornhill.
Mr. Speaker, many Canadians can't travel. They can't leave this country. Many have been terminated, and they have been othered by this government for long enough. The government's top doctor stated that vaccine mandates aren't effective anymore, yet the health minister won't discuss any timelines, benchmarks, or plans for ending them. He's not taking the hints from provinces. He's not taking cues from our international allies. He's not listening to his own experts. So on what day, in what year, will the health minister end the federal mandates that nobody is telling him to keep?
The Honourable Minister of Health.
Thank you, Mr. Speaker. We would all like to be able to declare the date on which COVID-19 will disappear. That would be marvelous, Mr. Speaker, and I would certainly be the happiest man on earth in this Parliament, certainly, to be able to tell you, Mr. Speaker, on what date this COVID-19 will disappear. Unfortunately, I don't know.
The Honourable Member for Thornhill.
It would be better if the minister cared about workers even half as much as he does about optics. Employers in the air transportation are experiencing worker shortages. They are terminating experienced workers because of the federal mandates. The very workers who were mandated to work through the pandemic are the same workers who are now on the verge of losing their livelihoods for good. The transportation minister can end the interim order on mandates before he strips workers of their pensions, of their benefits, and of the years of service. That's before April 16th. So why is the Minister of Health saying no?
The Honourable Minister of Transport.
Speaker, I thank my colleague for this question, but I really want to ask her to remind Canadians that vaccination is not a punishment. Vaccines have saved lives of communities, have saved our economy, have saved jobs. I understand that there are questions about when these mandates will be lifted. We will continue to follow science and advice, and I ask the honourable member to avoid partisanship in the face of vaccination.